Health officials say they continue to aggressively work at eliminating the threat of the coronavirus entering the country through ports of entry. Acting Chief Medical Officer Dr. Francis Martin stresses that apart from the passengers coming through the international airport, cruise ship passengers are also being screened for symptoms associated with the virus. In an exclusive interview with GBN, Dr. Martin explains that each time a ship docks on our shore, it is visited by a medical officer.
The normal process is that whenever a ship comes to port, our port health officer goes onto the ship, and they go there for that particular reason, to ensure that first of all there aren't any sick person that poses a threat to us as a nation. The medical providers on the ship, they're aware of those because those are international health regulation standards that all ship must abide by. So these ships will not be annoyed if we decide to prevent disembarkment or avoid or refuse pratique, if you want to call it that way.
Dr. Martin also spoke of other systems in place at the cruise ship terminal in St. George.
Further to that, on St. George's Port, for example, where the cruise ship is, there is a small medical outpost there that may, in the event that something happens, be able to mount a response as well. And that has been going well for many, many years. You know, yesterday there was a patient that needed ambulance transfer to the general hospital from a cruise ship, and that was done seamlessly. Patient got the care they needed at the general hospital and then returned to the ship. And so we really just want to reinforce that the process is working, and we just need to continue to build it.
The CMO added that all passengers showing symptoms will not be allowed to leave the ship when it docks.
First of all, the cruise ship risk for influenza to our nation is quite low, for the simple reason when the port health officer goes onto the ship and check the health records or the declaration, anybody with respiratory illnesses or symptoms are refused disembarkation. They're not able to come off the ship. Once they have any gastroenteritis, or gastro as we call it, or respiratory tract symptoms, they are refused entry. They're not supposed to disembark that ship. So,
for GBN News, I am Rina Perry reporting.